Yeah, Madam Speaker, recently a mother approached me about the WRHA's decision to terminate 2 lactation consultants. She said in a letter to the WRHA and to the copy to the Minister of Health and me that she had only found the care that she and her son needed from specialized lactation consultants at the Health Sciences Centre. I received a response from the WRHA's Riel Cloutier and an email from the chair of the WRHA criticizing Mr. Cloutier's response for emphasizing cuts over care and wondering, and I quote, if this decision holds water. Does the minister agree with the chair of the WRHA that his government puts cuts before care for newborn children and their mothers?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, certainly the member opposite knows a little bit about cuts when it comes to the federal government reducing support here in Manitoba. There continues to be a decline of support from the federal government. We used to have a partner, a 50-50 partner many years ago. Now we have a 19% partner when it comes to healthcare from the federal government. I'm glad that the member opposite is now concerned about funding for healthcare. I wonder where his concern was a few months ago when we needed his voice. Yeah.
The Honourable Member for River Heights on a supplementary question.
Yeah, Madam Speaker, my concern is about services. His concern is only about cuts. Madam Speaker, the letter from the chair of the WRHA on the interim president's response to cuts in lactation specialists is twofold. She says the letter, which I table, acknowledges negative impacts and then says we must promote evidence-based care, particularly where there's evidence of long-term benefits and access to that care. The current draft suggests we are not sure ourselves whether the decision was sound and if the new approach is the right one. The Health Minister also received this email. Are he and the WRHA more concerned with messaging than with making sure that new mothers can breastfeed their newborn children?
The Honourable Minister of Health, Seniors and Active Living.
Well, we have lots of concerns, of course, Madam Speaker. One of the great concerns we have is the lack of support from the federal government. There used to be, at a time many years ago, that the federal government was a 50-50 partner in health. That was always the great compromise when it comes to healthcare in Manitoba. The federal government would set the rules, but they would provide 50% of the support to provinces over time, and particularly under the federal Liberal government, that decline has been reduced to the point where the federal Liberal government now only provides 19% support when it comes to healthcare, and yet they still insist on setting 100% of the rules. I'm glad that the member opposite has found his voice when it comes to support. I only wish he'd have found it a little bit earlier, Madam Speaker. Yeah.
The Honourable Member for River Heights on a final supplementary.
Madam Speaker, the Minister only seems to deflect instead of taking responsibility. At the very highest levels of the WRHA, it's clear there is doubt about the government's plan to break their campaign promises and fire frontline healthcare workers. The RHAs were created by the PCs in the 90s to have healthcare at arm's length from government, but the most powerful people in the WRHA now have no independence and no choice when the Premier and his health ministers order them to make cuts and little freedom to speak the truth. Will the Premier and his minister listen to the board of the WRHA and reverse this decision to cut lactation specialists, or will the people who have spoken get trimmed for speaking their minds?
The Honourable Minister of Health, Seniors and Active Living.
Well, Madam Speaker, there were at least 5 different conspiracies in that question. I would ask the member to remove himself from the grassy knoll, Madam Speaker. What we are doing is ensuring that there is a healthcare system that is sustainable. We are looking at evidence. We are hearing from experts. Dr. Peachy, who was hired by the NDP government, is one of those experts. We've heard from many different experts. I would encourage the member opposite to also listen to experts. There have been national experts who said that healthcare isn't sustainable without a true federal partner. That is an expert that the member opposite doesn't want to listen to. I would encourage him to listen to the many voices around Canada who said we need the federal government to be a real partner to make sure that healthcare is sustainable. He can stand here in this House and he can defend Ottawa all he wants, but he's elected to defend Manitobans, and he should stand up for Manitobans for a change, Madam.